is Ben. Ben lives in a rural part of central Vietnam. This is Ben's local hospital, where he feels the procedures are too expensive and the doctors too inexperienced. So what does Ben do? He travels all the way down to Ho Chi Minh City to perform any of the medical procedures necessary. Now, picture this, the Lunar New Year Festival in Vietnam. Ben is traveling, walking through the city with his family, and he comes across this site in the hospital parking lot. It's a festive, jovial atmosphere. Balloons, children playing, he sees people listening to lectures, and in the corner he sees the heart cart. Now the heart cart initiative will be Medtronic's new strategy to expand cardiac care in Vietnam. It will deal with the low patient awareness, with the doctor shortage, and it will increase the demand and supply of cath labs throughout the country of Vietnam. Now, how is the heart cart initiative going to work?
It's a really excellent question. There are going to be 3 levels. The first level, they're going to ask you socioeconomic questions and determine if you're in the high-risk group. They're also going to take some vital signs to try to give you that complete clinical picture, at least for that brief amount of time. And then they're going to move you to level 2 if necessary. And they're going to ask you questions about your lifestyle choices and talk to you about some preventative care choices as well that you can make. But we're also going to bring in a nonprofit as well to help us with some of that. Now, after gathering all of that data, if we decide to move you to level 3, we'll have you go to a heart cart and actually speak with a doctor to talk about some of your surgical options. And if you need one of those options, we set an appointment, and then the heart cart will come out to your location and area to perform those procedures. Now, not all the procedures can be done at the heart cart. For those more advanced ones, well, that's where our extension of the cath labs comes in, which is not only feasible, but absolutely profitable.
But what does that mean for Medtronics in Vietnam, a country which is the 3rd most populous country in Southeast Asia, a country where per capita income is just over $1,000, for a country where cardiovascular diseases is the most common cause of death? Well, a lot of opportunities. Why? Because the government spending on health insurance is huge. What we suggest is a 60-40 revenue sharing profit model between the healthcare solutions, Medtronics, and the local hospitals. And how's this going to work? It's because the government spending on an average heart surgery is over $2,000. There are over 2,000 operations which are estimated to be performed at every cath lab, which basically means $4 million worth of revenues against a cath lab cost of $600,000. So basically, we are retrieving all our investment in less than a year. That is military precision. See you in Singapore.